When I started 16 years ago, we used to see 40, 50 patients. I decreased my schedule. I now see maybe 20. It's a lot happier. You learn how to code better. So it's, we talk about RVUs, and you don't have to see 40 or 50 patients to make the same amount of money. You just have to be a lot smarter. And then you're less stressed and you're happier. Caring for yourself. I don't know how many of you all eat well. I'm a pescatarian for 2 years. Some people are vegan, but we have to learn to eat well. I know some of my partners, sometimes they'll go all day, haven't had their first meal. That's a big no-no. Eat at least every 4 hours. You owe it to yourself. Include physical activity in your daily routine. All my friends know that's number one. Get enough sleep. That's something I still have to work. I don't know how many people in here get like 7 hours of sleep a day. Yeah, that's what I thought. So, I hate to say it, for me, if I get 4 or 5, I feel pretty good, but of course, that's not how we should do it. Relax. I don't know how many people practice yoga, reading. What I'm starting to do before I go to bed, I have a book that I'm reading. I think right now I'm doing Tabitha Brown. Will Smith is next. And, it's something that I didn't really do a lot before. And I don't know how many people volunteer. So my daughter's into a lot of community services, so I do help her volunteer. And you definitely have to develop a support system. I do have one of the guys here that I'm training for his first marathon, and I have some folks that I've known for a long time. Actually, Dr. McNair, we went to county together, so sometimes you have to look at your support system. Sometimes it's out of your family, and you develop friends and different relationships, and then also know when to seek professional help. Sometimes it's okay to say you're not okay, and that's something that's very important. Doctors are always, the nurses are always supposed to be okay, but we're really not. So I don't know how many people have seen the resiliency triad. We'll get into it. We'll talk about values, self-care, and insight. So basically, it's a triad of beliefs used to weather the storms within the profession. These include aligning your practice with the values that support meaning or purpose in your life, providing the self-care of adequate nutrition, sleep, exercise, and social interaction, and developing insight into the behavior and motivation of yourself and others, what we just discussed. Here's the big one, physician burnout. You can raise your hand if you're a physician. How many of you feel like you're burned out? Or if you're a nurse, who's burned out? Not too many people? Okay, so you guys are...
I'm a physician. I'm retired.
You're retired?
So that's the recipe for burnout.
Yeah.
Get rid of it.
So a lot of physicians are retiring early. And the syndrome includes emotional fatigue, cynicism, depersonalization, and loss of meaning in work. And nearly 43% of American physicians, including 54% of primary care physicians, exhibit at least one symptom of burnout. And we're at risk of depression and substance abuse, which we don't talk about a lot. And a lot of male physician suicide rate is 1.4 times that of the general population, and nearly 300 physicians annually take their own life. Female physician suicide rate is 2 to 3 times higher than the average for women in the general population.
That is very concerning
It's very concerning,
as far as I'm concerned.
but it's not talked about much because we're supposed to be okay, right?
Yes, we should. Luckily, we're talking about it.
Yeah.
We're talking about it.
Mm-hmm.
And I think we should all be, not only in that, but try to figure out how to talk about it.
Yes, I agree. And here are some signs of burnout in the workplace. Regularly arriving late to work. The worst thing is your clinic starts at 8 o'clock, the doc shows up at 9. Reduce enthusiasm, goals, aspiration, and commitment. Increase, I'm never there, the doctor's never there. Poor treatment of work colleagues, making careless mistakes, uncooperative behavior, increased cynicism, and apathy. What are some of the causes of burnout? Lack of control, unclear job role and expectations, lack of work-life balance, a negative working environment. If you work in our office, if anybody that knows me, we're gonna have a good time. So we're gonna always smile, we're not gonna be just complaining too much. And then a lack of support is also a cause of burnout. Well, look at here. What are some more causes of burnout? If you see, some of these are in larger letters. So we'll look at my next slide and you'll see what it means. Administration. The EHR, especially for us, they're constantly changing. So you barely got it the first time, and then 6 months later, here they come with a new one. And it really drives you crazy. It's supposed to be better, but it's frustrating. You have all these people waiting, and what am I supposed to do? Documentation. Yeah, I know some of my partners have the scribes and different things, and some people, they do their notes, I think, a week or so later. So now Advocate has it, you have to have your notes done, I think, within 2 to 3 days. Paperwork, we don't really talk about paperwork. We're never really done, right? There's always, it's a paperless system, but we have a lot of paperwork. Does that make sense? Just pure exhaustion. Medical school debt, yeah, I have that. And now we're doing a lot of these Medicare wellness visits. So, those take even extra time. So, they want us to flip them. So a lot of times, that's not what the patient came, but this patient may not come back for another year. So you have a crowd of people waiting, plus you now have to do this Medicare wellness. So all of this mixed in, and you see that overwork, they have it real tiny. I think that should have been the largest one. So we get into this, I'm a family physician, so I'm a little biased, so everything that I talk about is a lot, for what we go through. This is our ecosystem, so a lot of things that start off with the healthcare system, and then your organization, your practice, your individual, and your physician culture. That's what helps makes our well-being what it is. And here's your top 5 specialties that are burned out. Emergency medicine, I have an emergency medicine nurse over there. Urology, rehab medicine, it should have been / also internal medicine. Family practice made it to number 4, and then radiology. So I don't know if we have, any radiologists in here. And so this is what I love to do. I love to talk about stress management. We have to do more than commiserate. You can complain, but what are you going to do about it? Avoid this cynicism, all this negativity. Like I said, do some reading. I would love for each of you to decide, hey, once a month, get into a book club, or, before you go to bed, what I used to do was look at the news, but it was very negative. So you had to really learn to do something else. So, like I said, I'm doing Tabitha Brown's book, Will Smith is next. Join a support group. What I do with some docs, we may every couple of months go eat at a restaurant. You got to get out. Consider therapy as a positive resource. Like I said, physicians, we're always supposed to be okay. But it's okay to get, some therapy. This is the next one, attend a wellness conference. This is something that I love to do. Family practice, I think we had one, but because of COVID, they canceled. They have an upcoming one coming up soon. The next one is strengthen your communication skills. If you don't let people know something is wrong with you, how are you ever going to get the help that you need? Address your patients and your own spiritual needs. I know we're not supposed to pray with patients or different things, but some of your patients, you do know if they are spiritual, if you're giving them a breast cancer diagnosis, it is okay to say, hey, I'll pray for you. As long, and I'll put in the chart if they're Jehovah's Witness or certain things, so, it won't be a bother. But I think when they see that side of you, they're willing to just be more open. And then job satisfaction. Do you wake up every morning and say, I'm excited to go to work, or you feel like this is a struggle? I mean, You know, so we have to turn that negativity into positive. You know, being intentional. We're gonna talk about looking to the stars. It's an acronym, and I'll go over what each of those letters stand for. Taking the first step, and next we'll talk about back to money.